Good
Good
evening,
evening, friends.
everyone.
Good evening, all faculties. Good evening, Dr. Hemant Gongolia, sir, Dr. Jai, sir. Welcome to the fifth session of nutrition series that we are conducting with Catchet Pharma. I will ask my president, Dr. Hemant Gongolia, sir, a few words on today's session. Sir.
Thank you, Dr. Amol. Good evening, all the respected faculties and the moderator, Dr. Parag Gaikwad, sir, as well as state convener, Dr. Jay Kumar Bhandarkar, sir, my secretary, Dr. Amol Pawar, sir, as well as editor, Dr. Neha Singh, and all the viewers on this link of this today's session. So we are extremely grateful and we are thankful on behalf of Maha IAP to Catchet Pharma to support this academic event. This is the fifth episode in the row, and we are looking forward towards today's session on the multivitamins and the multiminerals. I feel multivitamin is very, very favorite for the patients also. Patients, they do like. Doctors also like to prescribe. From all pathies, they like to prescribe that. Also, pharma is on the rise of producing them because it is a most used medicine. So I do not know how much this multivitamin is misused rather than its usefulness, but still there is some use of vitamins as well as minerals in certain things. So probably we are looking to this session, probably making our prescription also useful for useful prescribing of the multivitamin rather than misusing them to write each and time whenever the parents or anyone's asked, अरे जो ताकत द शक्ति दे का दवाई दे दो, टॉनिक दे दो, ऐसा तो बऱ्याच वेळेला आपल्याला पेशंट विचारतात की टॉनिक लिहून द्या वगैरे. तर let us see how we can come out from this. Very difficult to, but still we should try, and whenever we'll try, we'll get it. And probably our experts who are there today, we have nutritionists also here, and so let us see what they can give us to learn from this thing. So it will be a very good session. I am very sure about it because of very extremely good faculties. All the best wishes, and once again I thank Catchet Pharma to support this event. Thank you very much. Thank you, Dr. Amol.
Thank you, sir, for your encouraging words. Friends, as you all know, children need vitamins and minerals for growth and development, good health and healthy skin. It is also needed for good immune function. This we experience in recent times during COVID infections also. The deficiencies of vitamin C and D is the culprit behind the weakened immune system, and most commonly found in people with infections including flu and coronavirus infections also. To discuss all this, today we have very eminent faculties, pediatricians and nutritionists who will guide us in today's webinar. Today's session will be moderated by my dear friend, Dr. Parag Gaikwad, who is currently president of Pune IAP, which is a very vibrant branch of Maha IAP, and this branch is also always ahead of times. He is also secretary of Nutrition Chapter. He is a master trainer in nutrition module, infectious diseases, TB, clinical clues, TOT, naming names. Yes. TOT named as NAMES, which is related to school health. He is a regular faculty in Pedicon as well as Maha Pedicon also. He was editor of Maharashtra IAP Bulletin in past. So without wasting time, I will ask Dr. Parag Gaikwad to introduce his panelists and also to take over this session. Over to you, Dr. Parag.
Thank you, Amol sir. Next slide, sir, please. So we will start the session. Today we'll have panel discussion about the role of multivitamin and multiminerals in our immunity, pediatric immunity. So we have eminent panelists in our board. So first panelist is Dr. Prajakta Kunduskar Madam. She is consultant adolescent pediatrics and psychologist. She is director of Blooming Bird Child and Adolescent Health Care, Nagpur. and Joint Secretary of IMA Nagpur and Chairperson of Adolescent Health Academy Nagpur. She is also contributed the research project related to adolescent obesity, academic achievement of children, and development of self-concept in adolescent. Welcome, ma'am. Next, sir. Next panelist is Dr. Anurag Pangrikar, sir. He is senior pediatrician from BID, and he was president of IMA BID and organizing chairperson MAPCOM 2014. Welcome, sir. Next. Our third panelist is Dr. Niti Soni. She is senior pediatrician and adolescent health expert and nutritionist. Ma'am is faculty. Ma'am was faculty at Awesome, then faculty as AACCI module, conducted many workshops and received Best Paper Award at Pedicon 2022. Role of psychosocial factor in examination anxiety in adolescent. Welcome, ma'am. And our last faculty is Mrs. Mayuri Sahasrabuddhe Joshi, ma'am. She is qualified nutritionist and lifestyle management expert. She is also diabetes educator. She has experience of 10+ years, and her areas of expertise include type 1 and type 2 diabetes management, gestational diabetes mellitus, and weight loss. Welcome, ma'am. So we'll start the session. Akshita, I have sent you mail. Can you share? So I have some problem. Akshita?
Before Akshita starts sharing, I will request our state convener, Dr. Jay Bhandarkar, to say 2 or 3 lines.
Akshita, I have sent a mail to your email. Can you share the screen? Jay Bhandarkar, sir.
Yeah, I'll share, but can you please try it at your end first?
Yes, Dr.
I have
Jay,
some
and after
problem,
you
ma'am.
start sharing, madam.
Sorry?
Once Dr. Jay finishes his 2 lines, please share the slides.
Okay, thank you. Gongule sir, good evening to all of you. I have not come between the beautiful science or subject chosen and the esteemed faculties and our moderator. So friends, this is very important. We know we write a left or right multivitamins when there is no deficiency, as well as sometimes patient demand also of antibiotics. Rather given antibiotics, I find is a better way to give something which can having multivitamins or multiminerals, which doesn't harm to the patient, given the right doses. But when there is deficiency, you must diagnose it and give properly. So I know that all this extreme faculty going to give the beautiful information on the day-to-day routine required. We know below 5 years of age that all this 40% of all over world are in the risk of not getting to their potential of as an academic as well as their output. I can say they can even educational, right? So and then one of the part is the vitamin deficiency as well as iron deficiency. So and nutrition, that main. So let us heard from this our extreme faculties for this session. Thank you very much.
Yeah, thank you, sir. Thank you. Akshita?
Doctor, please allow me a minute. I'm downloading this slide.
Yes.
Dr. Palak sir, can you try or no?
I tried, some internal error is there.
Okay. You can try green screen, share the screen, just go and just try those. Okay, it's okay.
These Apple products are not compatible with this thing, Word and PowerPoint. So
by the time Dr. by the time our host shares the screen, Dr. Parag, you can start the introduction.
Yes.
The basic things about today's session.
So we'll start this panel discussion. So Today we'll discuss about role of multivitamin and multiminerals in pediatric immunity. So today's this panel discussion we have divided in three subset, you can say. So first we will discuss about what is immunity, disorders of immunity, and how this immunity is reduced or increased or something like that. Then in second part we'll discuss a individual multivitamin and multimineral, how their pathophysiology and physiology, basically how these vitamins and minerals are important in our immunity, and we'll go to cellular level and how these vitamin and minerals, how they act. We'll discuss about that, and lastly we'll go for this applied pediatrics, you can say, and we'll discuss about how we can use these multiminerals and multivitamin judiciously to increase the immunity, and also we'll discuss about how we can increase the immunity by non-pharmacological ways also. So these three subset we will discuss. So we'll go to first part of our discussion. So in this part we'll discuss about what is immunity and disorders of immunity. So first question to ma'am, that types of immunity, what are the types of immunity, and what is the difference between innate and acquired immunity? Kondoskar ma'am.
Thank you, sir. Dr. Gangolia, Dr. Amol Pawar, and Dr. Parag, and all my co-panelists. Thank you for giving me this opportunity to share my views. So as pediatricians, we all have learned this in microbiology, pathology, and everywhere in pediatrics itself. Types of immunity, we have got innate and acquired. So there are a number of conceptions and misconceptions to describe this. Immunity is considered as a state of resistance or susceptibility to disease caused by microorganism or toxins given by that.
Doctor, I'm sorry to interrupt, but it is a panel discussion, right?
Yes, yes.
Yes,
okay,
yes.
Is any of the speaker having the PPT, Dr. Prajakta?
No.
No.
These only the PPT, and just we will see this screen only.
Only you will be sharing. You will be sharing.
Doctor, in a panel discussion, it really gets tough for the host to manage, because if it's a one speaker, we can just do next. So I'll just put in the PPT in the group, and any of the speaker can download.
You can do one thing, that just give this remote to Dr. Parag so that he can operate. Akshita.
Neha, can you share? Akshita has some problem.
Doctor, I put the PPT in the WhatsApp group.
I already put.
Already it is there. I will again put.
Ma'am, please continue.
Shall I continue? Yes. Okay.
Yes, ma'am.
So, going again to science and arts of this micro and macro minerals and nutrients. This immunity, we have got two types of immunity, that is innate immunity and acquired. Innate considered as natural, that is born with. For example, it is like cough reflex. It's a born immunity. Mucus trapping, bacteria and foreign body trapping. So such kind of immunity is innate immunity. We are born with it, and it is of three types, like species related, racial related, and individual related. Like species specific, racial specific, like specific races are having that born immunity with them. Individuals like G6PD deficiency, they are immune to plasmodiums. So such individual innate immunity is we are able to see. This kind of immunity, it has got barriers like anatomical barrier, then phagocytosis, then inflammatory reaction and complement systems. In acquired case, like adapted immunity, we call it as. So we have got two types of adapted immunity, that is active and passive. And this active, we are dividing into natural and artificial, depending upon what kind of immunity is there, which is or given by or acquired by is active and passive. And again, active immunity is by natural source or artificial source. Similarly, passive immunity is considered as by natural source or artificial source. So the active immunity, active acquired natural immunity is considered as antigen induced. And then acquired active artificial immunity is, as we see in case of vaccines we give to the children. So the immunity is generated by vaccines. So that is artificial immunity. We are introducing antigen artificially, and then the immunity is created. So T cell mediated and B cell mediated immunities are here. Passive immunity we consider again natural and artificial, where passive is nothing but the vertical and horizontal transmission of antibodies, and artificial as IgG we provide in case of like the dog bite, or in case of certain conditions where the we need to provide with IgG. This T cell mediated and B cell mediated immunity is explained well, like T cell suppressor, helper, and cytotoxic. And B cell is nothing but humoral, as we all know. So it is when antigen exposure is there, lymphoblasts are there, then antibodies are there, and memory cells are there. So in general, we get 3 lines of defense. Like first is physical, where cough reflex sort of things are seen. Then innate immunity, which is naturally or born with immunity. And third is acquired, where we have got acquired active, natural, and artificial, acquired passive, natural, and artificial. I think I have explained it. If any queries, we can discuss it later.
Yes.
Over to you, sir. Parag, sir.
Yeah, thank you, sir. Thank you, ma'am. So basically, ma'am discussed innate immunity, that is by birth immunity is there, and acquired is by the exposure of environment, exposure of disease. This immunity is acquired. So innate is somewhat genetically related, and acquired is by someone acquires. So acquired immunity may be long lasting. So we'll go to second question. Now we have discussed the basic of immunity. So now we will discuss about disorders of immunity. So my next question is to Pangrikar sir. What is the pathophysiology of autoimmune disorder and allergic disorder? Because as madam discussed, there is balance between Th1 and Th2. This balance is very important for immunity to work. And if this balance disturbs, then there will be a problem. So, Pangrikar sir, this question is for you.
Good evening, all. Thank you for involving me in this panel discussion. Thank you, Maharashtra. We here and there use word immunity, immunity boosters, and nowadays it is a marketing gimmick. Everybody who wants to sell his own product speaks of immunity. But immunity clearing diseases, clearing organisms is a one part. But the other spectrum of immunity is when for a small antigen, body reacts very vigorously, and that gives allergic disorders. And sometimes the antigens of own, when they are not recognized, and our own body reacts with these antigens, that gives rise to autoimmune disorders. Regarding balance of Th1 and Th2, the hypothesis put forward was that there is a good balance in the normal stage. But when these antigens go inside the cell, the intracellular mechanisms that kill the antigen are by Th1 type. So interferon gamma, IL-2, tumor necrosis factor beta, all these are responsible. So that gives cell-mediated immunity, and that is local for that local area. By Th2 response, this interleukin 4, 5, 10, 13 are released, and that gives humoral immunity. So the antigens which do not go inside the cells and that go remains outside the cell, are killed by producing antibodies. So humoral immunity is a part of this Th2, and that is generalized. When we say that Th1 is defective, that means the diseases like Graves' disease, type 1 diabetes, these are said to be Th1 type of diseases. And for Th2, we can label as lupus and systemic diseases. All these go in Th2. It is said that the balance is well maintained between Th1 and Th2. Few medicines which dominate Th1, when Th1 balance is decreased, that may help sometimes against the diseases which are Th2s, like grapeseed extracts that stimulates Th1, probiotics, green tea, caffeine, that stimulates Th2 type of response. So whenever we prescribe some medicines, we have to think of which type of dominance in these autoimmune disorders is there. And if we prescribe the medicine which stimulates the dominant part, then that can exaggerate the disease burden of that disease. Thank you.
Yes, thank you, sir. So now we know how immunity works and what are the types of immunity, and we now know that how these disorders also, the pathophysiology of these disorders, how this balance is important, and if this balance is disturbed, then we'll have some allergic disorder or autoimmune disorder, and per se, we will have reduced immunity. Next slide, please. So now this question is from Sony ma'am. So ma'am, what is immunodeficiency and types of immunodeficiency? Now we know that types of immunity, and if this immunity is deficient from birth, or if this immunity is deficient after birth, then how to differentiate between this primary, secondary, or you can say congenital or acquired immunodeficiency? Over to you, ma'am.
Okay, sir. Thank you, sir. First of all, I'd like to thank the organizers, Gangolia sir, Bhandarkar sir, Amol sir, and the moderator, Parag sir, for giving me this opportunity. Now coming to the question directly, like what is immunodeficiency and what are the types of immunodeficiency? So immunodeficiency is a state in which the immune system's ability to fight infectious diseases and even cancer is either compromised or is entirely absent. In most of these cases, the immunity is acquired, that is secondary, which is usually due to some extrinsic factors, factors from outside, like some infection, for example, say HIV, maybe some environmental factors like nutrition, the topic that we are dealing today. It could be because of some drugs, like long-standing use of steroids, or it could be because of various hormonal and the metabolic disorders like anemia, then hypothyroidism, hyperglycemia. Immunity can also get depressed because of smoking, alcohol, and drug abuse. These things we are considering it now because we have a big adolescent population who are engaged into all these activities. And there is another set of immunity loss when there are big competitions and the athletes, they go into heavy training schedules. In such situations also, the immunity is depressed. Then the primary immunity is usually congenital, and but it is not as common as the secondary immunity. Here usually these are autosomal recessive X-linked, and around 95 different types of primary immunodeficiency syndromes have been identified. It could be maybe malfunctioning of some lymphocytes or granulocytes or something of that sort. But depending on the component involved also, the deficiencies are classified. Like the humoral immunity, where the B cell is deficient, then the T cell immunity, usually it is seen with patients with AIDS. Then there could be a granulocyte deficiency, which could be cytopenia or it could be cytosis, like decrease in the number of granulocytes or absence of granulocytes. Then it could be absence of spleen or splenia and complement deficiency. So usually the immunodeficiencies are divided into primary, secondary, and according to the component into the further types. Thank you,
Okay, thank you, ma'am. Can you elaborate, ma'am, immunodeficiency after birth, that is acquired immunodeficiency?
Acquired immunodeficiency, as I said, is because of different factors, extrinsic factors like drugs,
Yes.
like long-term use of steroids, which we give for nephrotics, or rheumatoid arthritis, all these cases, or some chronic infections
Chronic
like
illness.
tuberculosis, HIV,
Yes.
all these infections.
Yes.
And nutrition in itself plays a very big role in decreasing the immunity. Like anemia, maybe in diabetes, there is hyperglycemia, which can reduce the immunity. Plus the other factors, like I had said, alcohol, smoking, drugs, heavy exercises. These are the causes for the secondary
Yes, and malnutrition also. Malnutrition is also sort of stage of immunodeficiency. Okay, thank you, ma'am. Next, please. Okay, so next we will discuss about the importance of vitamins and minerals in immunity with respective to a group of vitamins and minerals and trace element. So we'll discuss one by one the vitamin, how they work, how they are how these vitamins are important in at a cellular level, how they are important as a immunomodulator, and some vitamin like vitamin D act as a hormone also. So we'll discuss one by one. So we'll discuss about their daily recommended doses and how they act. So first question to Mrs. Sahasrabuddhe, ma'am. So can you describe, ma'am, vitamin A doses and how this vitamin is important in immunity?
Yes, sir. Thank you, sir. So I'll start with vitamin A. So vitamin A is a very crucial micronutrient, a fat-soluble vitamin, which is, we all know, essential for maintaining good vision, growth, and
I'm unable to hear.
Work issue probably.
Is freezed. Her video is freezed. I will call you.
development. It also helps in protecting the epithelial tissue and
Yes.
yeah, am I audible now?
Yes, now.
Yeah. So it helps in protecting the epithelial tissue and the mucous membrane, which can form as a front line of defense against the pathogen invasion. Secondly, the immune organs, where most of the immunocompetent cells proliferate, differentiate, mature, and aggregate, they need constant dietary intake of vitamin A to maintain the concentrations. The retinoic acid, which is a metabolite of vitamin A, plays a crucial role in innate immunity regulation. Vitamin A is also essential for the differentiation of colonic CD169 positive macrophages, which primarily function in viral, many viral infections, autoimmune diseases, and tumors. Retinoic acid is also a control factor for regulation and maintaining the T cell homeostasis. Vitamin A is also involved in the synthesis of immunoglobulins and has an important influence on the humoral immunity. There are a few theories which say that vitamin A can be used therapeutically for preventing and curing certain diseases, mainly tuberculosis and HIV. But we need more studies about that. So yeah, the RDA for vitamin A in children is 400 micrograms. For infants, it is 300 micrograms.
Okay.
Coming to vitamin B, yeah.
Ma'am, one, two food items from which we can get vitamin A.
So yeah, vitamin A rich foods are all the orange and yellow colored fruits and
Citrus fruits,
vegetables. Yeah.
yes.
So mangoes, oranges, sorry, not oranges, mangoes, carrots. Then vitamin A is also present in fish and homemade butter.
Yes. Yes. So now vitamin B. So vitamin B is also water soluble vitamin, and
Yeah.
there's subtypes of vitamin B. Vitamin B is also important for immunity. So please describe vitamin B and E.
So amongst the B complex group of vitamins, the three main uh, vitamins that play a role in immune function are vitamin B6, B9, and B12. Okay, so B6 is a very, B6 like pyridoxine participates in almost entire functioning of the immune system. It plays a very important role in production of T lymphocytes and interleukins. Vitamin B6 has been shown to reduce the complications and symptoms of COVID-19. This was found recently, mainly because of its anti-inflammatory properties. It helped in reducing the oxidative stress. Supplementation of B6 also help in alleviating the COVID-19 symptoms. B6, another important thing about B6 is it influences the formation of intestinal microbiota, which is very important for normal immune function. It is also essential for absorption of vitamin B12. The recommended dosage for vitamin B6 is 0.9 to 2 mg per day in children. Then vitamin B9, that is folate, it is important in the production of RNA and DNA, the nucleotides that are necessary for immune system. Folate deficiency also reduces the circulating T cells and their proliferation. Then homocysteine, which is a protein metabolite, is broken down by B6. And if B6 is deficient, B9, and if B9 is deficient, the homocysteine levels can get abnormally high, resulting into more oxidative stress and suppressed immune function. So the RDA for vitamin B9, that is folate, is between 150 to 400 micrograms in children. And lastly, vitamin B12. So B12 plays a very important role in cellular immunity, mainly relating to the CD positive cells and the natural killer cells, which have an effect on cytotoxic cells. It acts as an immunomodulator for the cellular immunity. B12 is very important for maintaining the gut microbiota again. So it promotes healthy digestion, reduces the inflammation in the gut, helping to prevent conditions like leaky gut and many other digestive disorders. So so vitamin B12 is mainly found in non-vegetarian foods, milk, and curd. The recommended dosages for vitamin B12 is 0.5 to between 0.5 to 0.9 in children. And lastly, vitamin E. So vitamin E is a fat soluble vitamin and a potent antioxidant that scavenges the free radicals and reduces the oxidative stress. It has also been shown to increase the cell division and IL-2 producing capacity of the naive T cells, which are capable of forming the immune synapse. Vitamin E RDA for children is 4 mg. I mean, for 0 to 6 months, it starts from 4 mg. And by the time the children are 13 to 14 years, it is 11 mg. So vitamin E is mainly found in sunflower seeds, almonds, peanuts, and sunflower oils, safflower oils.
Yes. Thank you, ma'am. Very well explained. So vitamin A is important for this respiratory epithelium, skin functions, and epithelial functions. Vitamin B is also, you said, very important for immune functions. And vitamin E is for oxidative stress reduction.
Of the oxidative.
And yes, and these three vitamins are very important. These three are two are fat soluble and one is water soluble. These three vitamins are important for basic immunity functions. And if their deficiency is there, then vitamin deficient immunity disturbance is there. Also, we will have some disorders like color blindness, pellagra, like things may happen. So thank you, ma'am. So my next question is for Kunduskar ma'am. So ma'am, please, now we'll go to another two most important vitamins. We have seen their studies and literature mainly in this pandemic times. Many pediatricians, many adult physicians are giving these large doses of vitamin C and vitamin D. So ma'am, this question is for you. How this vitamin C and vitamin D is important as a immunity functions?
Yeah, it is self-explanatory. Since 2 years, we are happy with this vitamin C and D. We are prescribing and we are taking this medicine also. So vitamin C is water soluble, and this is important in immunity, such as oxidative burst and self-protection of the cell. So daily recommendation depends upon the life stages, like infants, children, adolescents, and adult. So in infants, that is 0 to 12 months of age, in males it is 40 to 50. In males and females, it is 40 milligram per day to 50 milligram per day. And in children from 1 to 8 years, it is in males it is 15 and females it is 25. Then in adolescents it is 20 to 85 in males and 90 to 105 in females. In adults, 75 in males and 90 in females, and in pregnant females it is 85 to 120. But seeing all this is just RDA. And prescribing is such a difficult task in such situations which we have gone through during COVID situations. Like we have to prescribe this medicine for kids from 0 to 18 years. So availability of the market availability of this vitamin C is to be considered while prescribing. And we have to consider the upper level of the dose. Like in children, it is 650 per day, and in adolescents, 1200 per day, because it is seen these days that 500 mg tablet is prescribed and it is taken twice a day for very long duration, considering that the child will not get COVID at all. So this was the notion behind taking this medicine, which is again not right, because we know the problems of hypervitaminosis. Not very common, but with this COVID, we have seen these. And the function of this vitamin C on immunological modulation is in such a way that it increases phagocytic function, and it increases absorption of iron and reduces allergic reactions. As it increases absorption of iron, it helps in building up hemoglobin. And that is why, again, the risk of risk of infections is reduced. Then increased collagen leading to barrier integrity, increased carnitine giving metabolic energy, increasing catecholamines and mediated peptides, causing hormonal regulation, but decreases hypoxic inducible factor, that is gene transcription, and DNA and histone methylation, that is epigenetic regulation. Discussing this is again a very big topic, but it is just a key. These are the key words what this vitamin C does. And the sources, we all know that citrus fruits,
Yes.
or 2 oranges fulfill the daily recommendation dose. So generally we advise that have 2 oranges daily. Then considering vitamin D, which is very, very important, this is cholecalciferol, and the active form is vitamin D3. It is again a lovely drug, which is really helpful in reducing infections, chest infections. It is very, very important as a hormone also, that is 1,25-dihydroxycholecalciferol. And beyond the effects on bone and calcium homeostasis, its ameliorative effect is that it modulates innate and adaptive response of the individual, and it is capable to act as an autocrine manner, that is absolute power in itself in local immunological milieu. So what does it do? It actually activates T cells, helper and suppressor T cells, and it increases microbial killing in such a way that in case of innate immunity, it causes reduced cell maturation and decreased antigen presentation. So it increases microbial killing. And in adaptive immunity, it decreases cell proliferation and differentiation and causes microbial killing. So such is the use of vitamin D in immunity. Its daily recommended dose is again a very good topic to discuss, because its sources, it is again oil based, like fat soluble vitamin. So up to age 1 to 18, like first year 400 international units, that is 15 microgram is the daily recommended dose, and 1 year to 18 years, it is 600 international units, that is and we generally see that cow's milk is great source of it, and non-vegetarian food, that is fish, salmon, tuna. So these are giving much vitamin D. It is not possible for everybody to have this food in their daily diet. That is why sunlight is a very important thing, which is converting vitamin D into active form, and it is acting for absorption of calcium. Sometimes, like its deficiency is, we have to consider the levels in blood. Nowadays, it is possible for us to find out the levels. If we are getting few levels, generally quite less than 21 to 20, between 21 to 29 nanogram per ml, then it is considered as vitamin D deficiency. So 30 plus is normal value, and less than that is deficiency. So if we find deficiency, then for the age less than 3 months, we have to administer 2000 international units daily for 3 months. Then for more than 12 months, we have to prescribe same dose, and along with that, single dose 5000 international units once. Then 12 months to 12 years, it is generally 3 to 6,000, and single dose, if we want to prescribe, it is 1.5 lakh international units, and more than 12 to 18, it is 6,000 daily, or 3 lakhs as a single dose. So this can be the prescription which is required for vitamin D deficiency. And this is secondary prevention. But in primary prevention, what we do generally since birth, we prescribe 400 international units daily for a child, for a baby, for 6 months, and thereafter seeing the complementary food and other things, other features of vitamin D deficiency or normal, whether that child is normal, accordingly we prescribe later on.
Yes, thank you, ma'am. Very well explained. So this vitamin D, much research and papers are every I think every site is flooded with the information, and I think in pandemic also we got many research papers. The vitamin D levels we are seeing in these articles and everywhere everything are Western I think values. In India, I think we can have some slightly less values as a positive as a normal value. So thank you, ma'am. Sunlight is very important source of vitamin D, and as you rightly said, vitamin C is seen in citrus, and avla is also richest source of vitamin C. So thank you, ma'am. So next question is for Dr. Pangrikar sir. So this
Parag
iron
sir,
and
Dr. Parag sir, the
uh,
3 lakh setters stat dose which was said, is it recommended still or it is out?
now it's not recommended because this cross therapy and other
Yes,
high dose
yes.
therapy is not recommended by
Not
IAP.
not recommend. That is why it is
Now,
in or.
yeah, and IAP also suggests that we can
Daily.
have slightly less dose as a slightly less level as a normal level, but 400 international unit till 1 year is recommended dose
Yes.
for all
Yes.
infants irrespective of his gestational age and everything. Yes. Next question is for Pangrikar sir. So the two most important minerals, that iron and calcium. So iron is, I think, most important mineral in immunity function, and it's important in pediatric and also in ANC period also. This iron and calcium. So Pangrikar sir, please give this insight for iron and calcium.
Iron is being highlighted since long in pediatric age group, ANC age group, ANCs, in older people also. And in Asians, we usually encounter with iron deficiency states. Iron is crucial in many metabolic pathways in immune cells. Basically, iron regulates the function of T lymphocytes. Iron deficiency, when there is iron deficiency, neutrophil function and natural killer cell activity is impaired. But the beauty with these lymphocytes is that when there is mild iron deficiency or moderate iron deficiency, these lymphocytes increase their meet their iron requirements by increasing expression of surface transferrin receptors. When these antigen processing cells attach to these cells, T lymphocytes, and the iron deficiency is there, they increase the surface transferrin receptors, and by that they extract more iron inside the cells. Basically, iron requirement for infants is around 11 milligram per day. For 1 to 3 years, 7 milligram. 4 to 8 years, 10 milligram. 9 to 13 years, 8 milligram. Boys 11 and girls 15 milligram. The second mineral that is important is calcium. Calcium acts as second messengers in many cell types. Usually the T lymphocytes have low concentration of calcium, but when they are presented with antigen receptor cells, there are store operated calcium channels. These channels open up and there is calcium influx inside the cells. Normally in the muscles, we see that there is depolarization, then there is calcium influx. This system doesn't work in lymphocytes. There are store operated calcium channels, and it has been said that there is a much more scope of research on this store operated calcium channels in autoimmune diseases. They plan to have medicines which will close these store operated calcium channels and decrease the influx of calcium inside these cells to reduce autoimmune disorders. Or in combined variable immunodeficiency, these store operated calcium channels are not working. So they can other system work to operate such channels and do influx inside the lymphocytes. The calcium requirements for up to 1 to 3 years is around 500 milligram per day. 4 to 8 years is 800 milligram per day, 9 to 18 years is 1300 milligram per day, and 19 to 16 years is 1000 milligram per day. Rich source for calcium is dairy products, ragi, and a rich source for iron is green leafy vegetables, drumstick, non-vegetarian foods. That's all.
Yes, thank you, sir. So this iron deficiency, I think, very important in our Indian subcontinent. We have seen that adolescent girls are deficient in iron and their immunity is low. These adolescent girls get married, and then their children have this again nutritional iron deficiency, and this cycle goes on. So iron deficiency is like a chronic disease, you rightly said, sir. So
And this
in
is
this,
reversible. When we
yes,
supplement with iron, the immune functions improve.
yes, and this calcium and vitamin D combined deficiency is also like a immunodeficiency state. We'll have multiple bone problem, and most important, recurrent respiratory infections are there. And this iron deficiency, most common causes, I think, in India, hookworm and worm infestation is still there. And because of this worm infestation, iron deficiency in school going children, and again children will have recurrent respiratory infections and recurrent GI infection. So most important, these two minerals are most important, I think, with respect to immunity. So lastly, this question is for Soni madam. Please tell briefly about remaining stress element like copper, selenium, and zinc. Zinc is, I think, most important. And like vitamin C and vitamin D, there were many research paper about zinc, and all physicians are giving left to right zinc, higher dose of zinc, 10, 20 milligram, etc. One question from, I think, Dr. Anand, that vitamin C hypervitaminosis. Yes, vitamin C is water soluble, but still, if given with very high doses of vitamin C, then there will be a problem of vitamin C. Mainly crystalluria will be seen, and cartilage
Yes.
damage, and knee joint and ankle joint pain is also there. Am I right, Kundushka ma'am?
Yes. And this
Yeah.
is quite commonly seen in children less than 1 year, infants, when it is given by the parents in COVID era. So we got various hypervitaminosis symptoms and signs in such infants. So it was not very obvious in children, but for infants, as a daily recommended dose was quite low, and it was provided too high in these days to avoid the infection.
Yes, misused vitamin.
Yeah, misuse.
Yeah. So last question is for Soni ma'am. Please tell briefly about the stress element.
Yes, sir.
Over to you, ma'am. Yeah.
Before I start with the trace elements, suddenly magnesium has come into fashion after COVID. And I'd like to put a
Yes.
word about magnesium as well, because it plays a very significant role in the immune function by regulating various functions such as immune cell adherence, immunoglobulin synthesis, binding of IgM lymphocyte, and antibody dependent cytolysis, and macrophage response towards lymphokines. And so with the COVID virus, other viruses also respond very well to the good amount of magnesium in our body. The recommended dose is for 1 to 3 years is around 80 milligram per day, which in 11 to 18 years goes up to 360 milligram per day. So it is usually magnesium is an element present in chlorophyll. So all the green leafy vegetables are rich source of magnesium, and usually we do not, as in Indian scenarios, we usually do not have magnesium deficiency. But in the COVID period, we did find lots of patients with magnesium deficiency. And after that, I'll just like to go with the micro and the ultra micro minerals which are there. These are those minerals which are usually needed by the body, and their doses is usually less than 100 milligram per day. And the ultra micro minerals, they have a dose of less than 1 milligram per day. So topping them is zinc. As you said, And we are very fond of using zinc, and rightly so, because zinc is very crucial for the normal development and functions of cells mediating innate immunity, the neutrophils and the NK cells. The macrophages also are affected by the zinc deficiency. The phagocytosis and the cytokine productions are affected by zinc deficiency, and zinc adversely affects the growth and function of the T and the B cells. The recommended doses is 2 to 10 milligrams, and zinc is usually found in meat, poultry, milk products, etc. But the part which even I want to highlight here is that even hyper dosing of zinc, like can in itself reduce the immunity and will reduce the HDL levels in the body as well. So so zinc needs to be given in a really correct dose of 2 to 10 milligram per day. And it is not to be given over a prolonged period of time. Next in the list is copper. Copper is an essential micronutrient against all the viral infections, and copper is involved in the normal functioning of the B cells, the T cells, the macrophages, the NK cells, and also involved in the cell-mediated immunity. And when we encounter uncommon microbes, then this copper really fights these organisms. It damages the viral genome and impacts the viral morphology irreversibly. And copper has a very beneficial effect in the H1N1 virus, and it also had a good effect on the COVID virus. So the recommended doses for copper is for 3 years, it is 0.4 milligram to 1 milligram per day. In 4 to 10 years, it is 1.5 milligram per day. And in adolescents, it is 1.5 to 2 milligrams. Most of these micronutrients are found in the whole grains and the nuts. And so these things need to be consumed in a good proportion. Similarly, for selenium, selenium has antiviral and anti-inflammatory properties, and the selenoproteins regulate the normal functioning of the immune system. And the recommended dose for selenium is 50 to 60 micrograms per day. Thank you, sir.
Yes, thank you. So now we'll move ahead. Now the basic of immunity and everything we discussed. Now we'll have some brief question and answer session and applied this, you can say, immunology. So next question is for Pangrikar sir. What is this concept of therapeutic doses? We already discussed about therapeutic doses with last discussion, but just briefly, can you tell about the therapeutic doses concept and what are the indications?
So there was a message that we should wind up in 5 minutes, so I will be
Yes.
fast. That it is said we have discussed the recommended daily dosages for various vitamins. Like for iron, we said that it is around 7 milligram, or for infants it is 11 milligram. But the absorption, bioavailability, and the fulfilling the stores, everything is to be taken in consideration. So whenever we prescribe iron, we used to say 3 to 6 milligram per kg per day as a therapeutic dose. Nowadays, it is said that 3 milligram per kg per day. When we say, like, regarding calcium, it is 500 milligram required, but when we prescribe it, around 1500 milligram. Like vitamin B12, when the required dose is 0.4 microgram, but we prescribe around 500 microgram. Like that, the therapeutic dose is for treating these deficiencies, and it is for certain period, that you should not continue these extra dose for long duration.
Yes, rightly said, sir. And COVID era, we have prescribed too much therapeutic doses for long duration. Okay, so next question is for Mrs. Sahasrabudhe ma'am. Please give some insight about this my plate concept and what is rainbow diet.
Yeah. Can we have the picture of
Next slide.
my plate?
Yeah.
Yeah. So this illustration is actually by USDA, but Indian plate slightly varies from this, but is more or less the similar. So this the my plate concept is all about explaining the patients about how to eat a balanced diet. And if you see the plate, half of this plate is filled with fruits and vegetables. So lots of salads, lots of variety of vegetables which are locally available, leafy vegetables, fruits are recommended here. 1/4 of the other remaining portion should be coming from grains, complex grains and carbohydrates, potatoes, sweet potatoes, cereals and pulses. From the remaining part, that is the protein part, a small part should be there to include healthy fats like nuts, seeds, oils, butter, coconut oil, and the remaining part is for protein rich foods. So consuming all the foods from these food groups is essential to maintain a good health status, and then that can be a rainbow diet which includes all the variety of food groups.
Yes, thank you. So this my plate concept is from Western countries.
This is a Western
but
concept.
yeah. But Indian version is most important because we usually have large amount of carbohydrates and protein
Yes.
less. So most important, we should add this protein rich food in our daily diet of children with some amount of dairy product, and we usually miss the fruit part. So this my plate is very important with Indian context, that we should add fruits, vegetable, grains, proteins, and dairy.
And
So
healthy
and
fats.
this, yes, healthy fat. And rainbow diet is, you can say, as baby's plate should contain all colors of fruits, so that baby should eat by just seeing the colors of the fruit. Okay, thank you, ma'am. Then next question is for Kundushka ma'am. So we have seen this my plate concept. Then with Indian concept content, what is this balanced diet, and how to give this balanced diet with all nutrients added, and whether this is important for to boosting the immunity?
Yes, generally we talk about low carbohydrate diet and high protein diet. But sometimes we have to consider that the balanced diet is nothing but carbohydrates need to be considered in that, except few white like starchy items like potato or rice. But rice is also very important as far as vitamin B is considered, isn't it? So that is why carbohydrate low means no carbohydrate should be avoided. So carbohydrate need to be given, grains need to be given, fruits to be given, vegetables to be given, and beans and non-sugary beverages like we can consider milk or buttermilk, which is very important. And then recommend, as madam already have said, that healthy oil or ghee. So daily we can recommend ghee, one spoonful of ghee it can be considered in balanced diet. It will not increase the fat. So, and another thing I would like to say in this, that balanced diet is same for all, but considering today's era, balanced diet for children and balanced diet for adolescent differs, because of their own thinking, own myths and own conceptions. Like in children, we give 5 servings: breakfast, lunch, snacks, dinner, and in between, if sometimes some schools provide the recess, that time. So 5 servings are to be given in children. Same is applicable to adolescents also. So all the contents have to be there in these 5 servings, where generally adolescents avoid taking this particular number of servings, just because they don't want to become fat, or their misconceptions, and because of that they are opting for junks, and they are not taking the balanced diet, or they are skipping important food like breakfast, snacks. They are skipping it and just having 2 or 3 servings, which will definitely cause deficiency of vitamins as well as micro elements, and this is leading to problems in adolescents. So children, to some extent, we can advise parents to give such sort of balanced diet to children, and that is the parents, they are following it. But for adolescents, it is slightly different because they are their own, and generally they go for these junks, like junk food with high fat and salts, packet foods, ultra processed food, then nutritionally inappropriate, caffeinated, carbonated, and color food, and then sugar sweetened beverages. And because of this, generally we need to educate them about the balanced diet and how these micronutrients boost their immunity rather than having less number of servings in a day. So they can have all the 5 servings with the balanced diet without getting fat and getting high immunological status of their own to avoid the infections.
Yes, thank you, ma'am. Very well said. So this 5 serving is important. 1 breakfast, 2 meals, and 2 snacks. This concept is very important. So next question is for Soni ma'am. So many parents complain about my child is having recurrent respiratory infection, my child is having recurrent diarrhea, my child is having recurrent viral infection. So is it a immune deficiency or something else? And can it be boosted?
So this is the question that we face in our day-to-day OPD. Almost most of the parents, they keep on saying that their children are not having a good immunity. So give some immunity boosters. But then we really need to evaluate whether these children are really immunodeficient or whether this is just the parental psychology that a child is falling sick frequently. So Nelson has very beautifully given us the guidelines on which children need to be evaluated for the immunodeficiency and which children the parents feel that their children are immunodeficient. They have given 5 points. First is if there are more than 2 or more serious infections, serious bacterial infections like sepsis, osteomyelitis, or meningitis in a year, or if there are 3 or more serious respiratory infections or the soft tissue infections like cellulitis, otitis media, and lymphadenitis, etc. The third thing is if the infections are occurring at unusual sites, like whether they are occurring in brain, liver, etc. Or if there are infections by the unusual pathogens like aspergillus, nocardia, etc. And the fifth thing is when the infections of the common childhood pathogens are there, but their severity is very high. If we find any of these 5 criteria, then yes, we do need to evaluate the child for the immunodeficiencies. But if it is not this, then we need to reassure the parents that no, your child is not immunodeficient, but yes, a good balanced diet, giving a good amount of multivitamins and minerals, preferably through the dietary sources only, then regular exercises, minimum of 30 minutes to an hour in a day. The children should play rather than going for gymming. So a regular outdoor physical exercise will automatically expose them to sunlight as well. Plus a good amount of sleep, which is actually lacking in these days. So around 8 to 10 hours of good, sound, peaceful sleep and protections from infections through vaccination can in itself boost up the immunity of a child.
Yes, thank you, ma'am. So very well said. These 5 points are very important. So we should counsel the parents rather than giving fake promises or fake prescriptions, you can say. So next question is for Pangarkar sir. Pangarkar sir, what are the changes in immunity pattern in this pandemic, post-pandemic era?
Basically, rather than immunity pattern, the behavior and the total environment of child was changed during this pandemic. Means when we started with pandemic, we were afraid that how to differentiate between normal respiratory infections, viral infections, and COVID. But surprisingly, everybody of us didn't see those many upper respiratory infections because these children were not there going mixing up with each other. One thing. Second part was that they were sitting at home. So the exercise part gone down. So obesity increased. So suppression of immunity because of obesity has been there. No viral infections has resulted in too many frequent viral infections this year. This year, everybody of us are seeing 2 to 3 viral infections in last 2 to 3 months. And people are talking that now my child has less immunity. But the fact is that these are viral infections and your child is bound to get viral infections during this season. And when it is less than 5 days with minimum complaints, it is not a sign of decreased immunity. In this pandemic, what we have seen is people have decreased the junk consumption which they were going for hoteling and that, and they have started eating breakfast. So in this pandemic, we have got mixed picture. Few things which are favorable for immunity, few things which are not favorable for immunity.
Yes, thank you, sir. And nowadays we are seeing the flooding of cases, maybe because of children are going to school, again eating junk food, not skipping the breakfast and everything. So next question is to Dr. Soni ma'am, how to prevent this reduction in immunity?
Like what I had said, during the COVID period, there has been a lot of discussions going on. What can be done so that you don't catch COVID? Kada le lo, then haldi ka doodh le lo, adrak le lo. But do these things really build up the immunity? Immunity is built up over time, eating the right food, the fresh fruits, fresh vegetables, whole grains, good food at a balanced diet, lean protein at a correct time. Also, the surge of fast foods which are there, which are rich in salt, sugars, and high sources of fats. Again, this will reduce the immunity. So once you reduce the consumption of these products, then automatically the immunity reduction will be prevented. The regular exercising, yoga came into a big as a big name only after COVID, because Modi ji started demonstrating the benefits of yoga to everyone. So exercising in any form, an aerobic exercise for good 1 hour will definitely improve your immunity and will lead to the good health of the child. Again, the sleep 8 to 10 hours and maintaining a suitable body weight, neither too high nor too low, a proper body weight for the age, and again avoiding alcohol and smoking will prevent the reduction in immunity in children.
Yes, thank you. So next follow-up question, last
Can I
question
add?
to, yes sir, yes sir.
Exclusive breastfeeding for 6 months and
Sure.
Yes,
complementary, timely complementary feeding with appropriate complementary feeds after 6 months.
Yes,
Absolutely.
yes. So next follow-up question to Dr. Sahasrabudhe ma'am, how to boost immunity? Soni ma'am already said many things, but how to boost immunity non-pharmacologically, other than medicines?
So yeah, ma'am explained many things about this. Just few points I would like to add. Mainly, a healthy and active lifestyle in children should be started at very young age. Like limited intake of sugars, limited intake of unhealthy fats and junk foods that can cause more oxidative stress in the body and then lead to reduced immune function. So all these things should be limited, and a balanced diet with all the necessary vegetables, fruits, grains, proteins, everything should be included in the diet. Gut health should be of a prime importance as well. So including probiotics, prebiotics in the child's diet is also very essential here. As well as maintaining a good sleep schedule, managing stress, and an active lifestyle. So all these factors can support a good, and help boosting the immunity as well.
Yes, thank you.
This is
And
what I-
follow-up question to Pangrikar sir, any drugs are there to boost immunity, or whether not to prescribe any drugs?
Sir, the best drug I would prescribe would be vaccine.
Yes.
And that is the only drug which is time tested and will help in boosting immunity. And the drugs which we have discussed up till now, when if you are seeing iron deficiency, prescribe iron. If calcium
Yes.
deficiency, vitamin C is lacking, or zinc is lacking, you can prescribe these medicines in appropriate doses for a certain period if you see a deficiency state. Otherwise, prescribing multivitamins and minerals for so long, 1 year, 2 year in inappropriate doses will not be recommended. Then people used to say that haldi, but haldi means what? The traditional haldi added to our diet is sufficient. It is not 1 teaspoon of haldi per day or like that. So our traditional diet is the prescribed medicine which has all the antioxidants, spices, and the vaccine that and the vitamins which are deficient. You have to correct the deficiency state. That is all.
Yes, thank you, sir. So most important thing is our take-home message is, if child is deficient with multimineral or multivitamin, we should give the right doses of vitamin and multivitamin. So deficiency state leads to reduced immunity. So last question to Dr. Konduskar madam. The word about malnutrition. Malnutrition is a state of immunodeficiency. So how to treat this malnutrition with vitamins and minerals?
Malnutrition, protein energy malnutrition was really the cases we used to get in our OPDs quite long back. But now this SAM has become endemic. So still, if we get such things like deficiency of micronutrients and or protein malnutrition, calorie malnutrition, so generally the death due to infection is seen in such cases, and these infections are due to impaired immune functions, and that is why generally we recommend first we have to assess the severity of that malnutrition patient with malnutrition. If oral supplementation is possible and effective, then only we can think of this giving orally, otherwise parenteral. So orally we can have vitamin A day 1 and repeat on days 2 and 14 only if child has any signs of vitamin A deficiency like corneal ulcers and history of measles. So less than 6 months we have 50,000 units, 6 to 12 months 1 lakh units, and more than 12 months 2 lakh. Then iron is we have to start at 3 milligram per kg per day after 2 days, and then catch-up formula and ready to use therapeutic food. If child is not on any of the premixed therapeutic food, then the micronutrients need to be given at least for 2 weeks, such as folic acid at 5 milligram on day 1 and then 1 milligram daily. Multivitamin syrup at as 5 ml per day, zinc at 2 milligram per kg per day, copper at 0.3 milligram per kg per day, and magnesium and potassium supplementation also needed in some cases. So generally we prescribe nutrient dense foods plus multivitamins with clean eating meal plan. Like Monday to Sunday, we are planning the 5 servings of these children as per the availability of the food and taking maximum nutrients out of the available food. So such is the generally prescribed thing in patients with severe acute malnutrition who can tolerate oral supplementation.
Yes, thank you, madam. So lastly, I'll ask all panelists to say only one liner take-home message, starting from Pangrikar sir. One line only, sir. Sir.
Rainbow diet and exclusive breastfeeding.
Yes, thank you. Konduskar ma'am.
Yes, all the vitamins are important, all the micronutrients are important, but they need to be given in proper daily recommended doses.
Yes, Soni ma'am.
A well-balanced diet, and a good amount of water intake is a must.
Yes, Gangulia sir, last sir, comments.
Homemade food, easily available, cheap ones, making the and seasonable, available to the season, depending on
Yes,
the.
thank you, sir. Sahasrabuddhe ma'am.
Sorry, sir, I had lost
One
network.
liner take home message. One line only. Take home message. Final.
Okay, so my final message would be, please go for a healthy diet and a balanced diet, and consult a dietitian whenever needed.
That is very
Yes.
important.
Yeah.
Yes. Amol, last comments.
Before Dr. Amol says, because Madam Mayuri is there, so can we have, because most of the time when we read the books and everything, so most of the
Yeah.
time it is written in such a way that lay person doesn't find appropriate, gets connected to the healthy diet. हेल्दी डाएट बोला तो बहुत कुछ अलग अलग दिखता है. सो वेदर वी कॅन थिंक ऑफ मयुरी मॅडम, जर तुम्हाला जमत असेल, युट्यूब छोटे छोटे व्हिडिओज बनवून ज्याच्यामध्ये असं सांगता येईल की हे खाल्लं तर तुम्हाला हे विटामिन मिळेल, हे खाल्लं तर, जे घरगुती असेल पण ते आपल्या घरात अवेलेबल असेल असल्या वस्तू
आयडियली
बनवायचं, बनवता येईल तर बरं, एक सजेशन माझ्याकडे.
आयडियली रेसिपीज मॅम, रेसिपीज, दिस रेसिपी, दिस रेसिपी, दिस.
Right. Yes, we can do that. We should do that, in fact.
Yes. सर एक डॉक्टर वैद्य, डॉक्टर उमेश वैद्य आहेत पुण्याचे आमचे, डॉक्टर उमेश वैद्य, त्यांचं एक छोटं बुक आहे, हाऊ टू गिव्ह हेल्दी डाएट टू चिल्ड्रन अँड रेसिपीज अबाउट हेल्दी डाएट, हाऊ टू गिव्ह हेल्दी टिफिन, असं एक बुक आहे. मी एक त्याचं कव्हर पेज टाकतो आपल्या ग्रुपवर, ते पण एक युजफुल होईल.
आता सध्या असं झालंय की चिल्ड्रन नीड हेल्दी ऑल्टरनेटिव्ह फॉर एव्हरी रेसिपी, सर. So instead of what we do currently is, instead of giving them different, we just try to modulate that specific recipe into a healthier version. So that is what we need to do currently. I mean, that is what working for us currently.
And the most important is eating without any screen.
Yes, very important.
Very difficult to.
So I am sure Amol will, with our MAHAIP own committee, will try to make alternative recipes, video clips from MAHAIP with the help of Madam Mayuri. I think so. Let's see what Amol responds to that.
Yes, good idea. Okay. So Amol, last comment.
Yes. Whether I should do vote of thanks now or last one liner.
Okay, so one thing only, important thing is, as all panelists suggested, healthy diet, healthy habits, and healthy physical activity. These three things are important. And for pediatrician, only treat the deficiencies, not to flow by these parents, and reduce immunity is different concept. Just recurrent infections is not immunodeficiency, so we should treat only deficiency of multiminerals and multivitamins, and we should treat by that right doses and not the therapeutic doses for longer duration. Okay, over to you, Amol.
Yes, Akshita has also told to wind up. So thank you, Dr. Parag, for nicely moderating this very important session. I thank Dr. Prajakta ma'am, Dr. Anurag Pangrikar sir, Dr. Niti ma'am, and Mayuri ma'am also, for guiding all delegates with a lot of information on various vitamins and multiminerals, and also their role in building immunity and in various immunodeficient states. Thank you all from Team MAHAIP. I thank all delegates for their patient hearing. Thank you one and all. Thank you.
Thank you.
Thank you. Thank you.
Night.
Thank you. Thank you.
Thank you, everyone.